Rasua Atava Pethawa, Rasua Atava Pethawa, Rasua Atava Pethawa, 4084, 4084, 4084. Oh, I didn't know you were here. It was actually a rap song. And see what happens when you become a doctor. Medicine can make you do everything. It was actually a trick to remember a little complicated portion, and we'll come to that later. You'll get to know. So let that curiosity be within you. So today's topic would be hypolipidemic drugs. It's a small, cute, and interesting topic. So first, let me give you a bird's eye view. This is the lecture. The theory part. And then certain related images. Yeah. Okay. Thank you. Okay. So starting with the theory part first. So as you can see, it is a proper professional, well, not so professional, but still it's a medical school lecture on hypolipidemic agents, and why on earth are we starting with some kitchen ingredient called garlic? In this era, when there is a hype for going organic, a few cloves of garlic a day may help you keep the doctor away. So as this lecture has started on the note of garlic, and it shall end with garlic. So there we'll discuss what is the importance of this garlic, this kitchen ingredient. So yes, this is another sort of an article which came up that where all patients may be requiring statins. We'll come to this once we are done with the basics first. So here we start with hypolipidemic agents. So as you can see here in this liver, just look on the left hand side first. What is happening? There is HMG coenzyme. It gets converted to mevalonate, and the enzyme required is HMG coenzyme reductase. Then comes cholesterol. This cholesterol is used, number 1, to make certain steroid hormones, and number 2 for bile acids. Okay. Then there is another thing that happens, which you can see on the right hand side. Don't worry if the diagram, I know, is a little hodgepodge, but each and every word I'm telling you, so just listen to me attentively if you cannot make out clearly what I'm saying. There is another thing that happens, everyone knows of it. There is enterohepatic circulation. That means the lipids, that is bile acids, once they are excreted into the intestine, again they are reabsorbed by the portal vein into the liver. And this cycle of reabsorption between intestines and liver keeps on continuing. That is enterohepatic circulation. So number 1 port or number 1 side is at the level of HMG coenzyme reductase enzyme. Number 2 is at the level of enterohepatic circulation. Number 3, you can see here there is PCSK9. There is this substance called PCSK9. What its normal role in the liver and in the body is to inhibit the LDL receptors, to inhibit the expression of LDL receptors on the surface of the hepatocytes. Okay, this is the third. This is, just keep in mind, this is the third site that I'm telling you to keep your attention at, PCSK9, which naturally down regulates the LDL receptors, means causes decreased expression of LDL receptors. So this is this site number 3. And another fourth thing happens, you can see this fat. This fat is getting absorbed into the liver. It is coming from the portal vein. So the absorption of fat into the liver, which is coming via the portal vein, this is site number 4. So first let me see how well you have memorized. Come on, tell me, what is site number 1? Everyone remembers? Yes, HMG coenzyme reductase, that is enzyme level. The second was at the level of enterohepatic recirculation. Exactly, good. And number 3 was at the level of PCSK9, whose normal, natural, physiological role is to cause LDL receptor down regulation. Yes. And the fourth one was the fat absorption into the liver cells. Right, good enough. So by manipulating these 4 sites, our drugs will act. So and this is all happening in the liver. And another thing happens, that happens at the level of blood vessels. These are fibrates, which act at the level of the endothelial cells, and they're too specifically in the nucleus of the endothelial cells lining the blood vessels, and they have to decrease triglycerides. These will be the 5th category of drugs, that is fibrates. But acting on the liver, we have these 4 types of drugs. Okay, so what was site number 1? HMG coenzyme reductase. The drug is called statins. The drugs are called statins, and this is where they're acting. okay, at site number 1. So what will be the effect of the direct effect? There will be direct cholesterol synthesis. Direct effect will be direct cholesterol synthesis, decreased cholesterol synthesis by the liver cells. That's it. Now, site number 2 was enterohepatic recirculation. This will be inhibited by the second class of drugs, and these are called bile acid sequestrants or bile acid binding resins. And because of that, there will be a loss of bile acids. And if you can see, the cholesterol which is synthesized in the liver is used to form steroid hormones of the body. Steroid hormones, the body needs it by hook or by crook. Steroid hormones are all these cortisols, are all your testosterone, are all your sex hormones also, and these are the stress hormones of the body. So come what may, the body cannot do without these hormones. These are the life-saving hormones, cortisol and all these steroid hormones. And the second important thing that is coming out of cholesterol is bile acids. So if you don't allow the bile acids to recirculate, the liver will be in a deficiency of bile acids, and it will have to synthesize more bile acids, and doing so it will use more of the cholesterol. And so in this way you are seeing that indirectly more and more cholesterol is slowly getting expelled out of your body. The third side I told you was PCSK9, whose normal role was to cause decreased LDL receptor expression. Now, if you inhibit PCSK9, there will be more and more LDL receptors. These LDL receptor will accept the LDL cholesterol, LDL-laden cholesterol from the plasma into the liver. So, the plasma LDL is going to decrease. And the fourth class of drugs will act by decreasing the internalization or the absorption by the method of endocytosis. Decreased absorption or decreased endocytosis or decreased internalization of fat into the liver cells, and these fourth class of drugs will be Ezetimibe. There is just one drug, Ezetimibe. So what are the four classes of drugs? Therefore, number 1 is statins. Number 2 are the bile acid resins or the bile acid sequestrants. These drugs, right now we are not coming to the names of drugs, just a class. First class was statins. The second class was bile acid binding resins or bile acid sequestrants. The third class of drug, which was acting by PCSK9 inhibition, so they will be called PCSK9 inhibitors. And the fourth class of drugs, it is Ezetimibe, no name, or you can say like fat absorption inhibitors or fat endocytosis inhibitors, like that. Okay, so this drug is called Ezetimibe. It's a relatively again newer drug, and so you need to remember this. Okay, so first starting with statins. Okay, so starting with statins, next slide, we are on next slide here. Okay, so statins are the drug of choice. They're the drug of choice with two conditions. One is hyperlipidemia and one is excess of LDL in the body. So again, indirectly they're the same things like excess of LDL, and LDL is a bad cholesterol, so excess hyperlipidemia, excess of bad cholesterol. Okay, and it is used also like as a prophylactic for other conditions which we saw in the this slide, right? So when can a patient be given statins? Whenever he has some some morbidity, some comorbidities, like some heart conditions like coronary artery disease, he has a risk factor of developing angina, or he have had an episode of angina or MI in the past, or went through percutaneous intervention, angioplasty or bypass for the same, or has some cerebral stroke history or peripheral artery disease or some other risk factors like a diabetes. In these patients, as a prophylactic also we give statins. And right now, in purview of this chapter where it is talking about hypolipidemic agents, it is the drug of choice for hyperlipidemia and excess LDL in the body. Now the next thing we know the mechanism of action. Pharmacokinetics, given orally, metabolized by the liver, cytochrome P3A4. It is unsafe in pregnancy. Now coming to the efficiency, and here is where the rap song came. So do you want me to sing it again? Let's try once. Oh my god, I'm making rap songs now. Woo! Rosuvastatin. Wait. The tune I don't know. I'm very bad at this. It is the first time in my life I would be making a rap song. Wait. Rosuva atava pethawa, Rosuva atava pethawa, Rosuva atava pethawa, 4084, 4084, 4084. Thank you. So depending on the efficiency, it was like Rosuva more than Atavra, more than Pitavastatin, and the doses for them were respectively 40, 80, and 4. This was all well and good. Now coming to the negative aspects. Number 1, myopathy. Number 2, liver toxicity. Number 3, dryness of skin. And number 4, weight loss. weight loss, I think it would be a positive thing, but according to medicine, it's a bad thing. Okay. So number one, myopathy, there will be weakness more than pain. In case of myopathy, there are some drugs which cause myopathy where the patient is complaining more of pain, but here there will be more of weakness, and especially proximal muscles will be affected more. Proximal muscles are affected, that means all these pelvic girdle muscles are affected, so the patient will be having problem with the gait, with the walking, that will be problematic. So how will we manage this condition? Like, we won't sit like that, right? We have to do something for the patient to prevent or at least to decrease the magnitude of this myopathy. So we can shift him to two drugs. We have two options, two such statins which have decreased myopathy issues. One is, the best is fluvastatin, and the second is pravastatin. Prava, prava. So fluvastatin is just preferred over pravastatin. And even then, if nothing happens, okay, decrease the dose of this flu and prava, still nothing is happening, the patient is still having complaints of myopathy, stop statins and start some other class of drugs. Okay, and other side effects I already discussed, liver and all that. Now coming to the second side was bile acid sequestrants, right? Okay, in this we have three drugs. Their names are a little atypical, like cholestyramine, cholestyramine. Chosyl is like fossil, so cholestyramine, cholestyramine. So this first drug, that is cholestyramine, it is also decreasing the glucose absorption in the gut, so it may be used, means it is better if the patient is having hyperlipidemia associated with diabetes. This last one, that is cholestyramine, it is another use, it is another indication also, that is it may be used for the gallbladder stones. Okay, the adverse effect is that since these drugs, they will allow more and more bile acids into the gut, means then into the feces, so there may be a condition of steatorrhea, and there will be a deficiency of the fat soluble vitamins. Okay, and there may be also gastric discomfort, so these drugs are not used much for as a hypolipidemic agent. Now coming to the third portal was PCSK9 inhibitors. PCSK is proprotein convertase subtilistin kexinine. Yes, it's a very exotic name. Proprotein convertase subtilistin kexinine inhibitors. Finally, it's very simple. All is that will inhibit this, so therefore there will be PCSK9. What was it doing? It was decreasing LDL expression. Now there will be enhanced and more LDL expression, so more and more LDL receptors on the liver. They will accept the LDL laden cholesterol from the plasma, and so the plasma cholesterol will decrease. The drug in this category, PCSK9 inhibitor, is evolocumab. Like evolution. Evolocumab. It's an oral drug that is cool about this. It's an oral drug that is good. Statins, they are also oral. These bile acid sequestrants, they can also be taken orally. This third class drugs, PCSK9 inhibitors, again evolocumab is also oral. Okay, it can be taken oral, right? Evolocumab, it is taken oral, but there are subcutaneous injections also which are available, which can be self-administered, right? Now the fourth class which is left with us is Ezetimibe. So for that I'll show you a diagram. Right now let's go for fibrates. In case of fibrates, what they do, the mechanism of action, see all these drugs, the first four drugs, they bind, and it means their action is somewhere in the liver, but its action is in the blood vessels, the endothelial cells of blood vessels, the nucleus of these cells. There is a PPAR alpha receptor, that is peroxisome proliferator activated receptor alpha. It binds to that receptor, stimulates it, and causes more expression and more stimulation of an enzyme called lipoprotein lipase. And so more lipoprotein lipase, there is more breakdown of triglyceride, and so it is a very good agent to decrease triglyceride levels. So it is a drug of choice for hypertriglyceridemia. Fibrates are best for hypertriglyceridemia. The name of various fibrates are fenofibrate, clofibrate, and gemfibrozil. Adverse effect is just like statins. What do you mean just like statins? Number one, myopathy. Number one, liver toxicity, dry skin, and weight loss. Then there are some miscellaneous drugs, okay, which may be used, which have shown property. such as niacin, that is vitamin B3. It increases HDL, but it's not used much because of the problem of causing insulin resistance and acanthosis nigricans, that is blackish pigmentation. There are other drugs also such as mepomersen sodium. It inhibits the mRNA, and this mRNA which was coding for B100 protein, and if you know B100 protein, it is a component of LDL. So what is it doing? It is decreasing the LDL synthesis by decreasing the B100 component of LDL. And then the third class drugs are some herbal products which are quite effective though, such as Hypolipidemic, which is a gum extract, and last was garlic. So I told you that our theory started with garlic and has ended on garlic. Now let's have a look at few diagrams. So class 1, or the first class drugs which I told you were HMG coenzyme reductase inhibitors. These were statins. Can you tell me the efficiency, that rap song? 4084. Okay. The second one was first, let me tell you, they were bile acid sequestrants. Okay, so this is bile acid sequestrants, and they will inhibit the enterohepatic recirculation. And which of the bile acid sequestrants is also effective in a diabetic patient? Cosilavalin. Yes, okay. Then the third class of drugs, they were acting at the PCSK9. They were PCSK9 inhibitors, so it is showing the same thing which I told you in a little complicated way. We know very simply what it will do. And what was the name of the drug? Evolocumab. So evolocumab, this is the subcutaneous. What I told you, it can also be used by subcutaneous route and can be self-administered by the patient. The fourth and last was Ezetimibe. You can see the effect of Ezetimibe on NPC1L1 mediated internalization of cholesterol. So you just have to remember in this diagram, this green thing is NPC1L1 protein, and this yellow fragments are cholesterol. So there are many steps which happen in between. A lot of complexes are formed, and this thing too is quite complicated, like clathrin mediated. Then there is AP2 protein which also has a part in this, and then it is transported with the help of myosin, microfilaments, all that finally. And then there is finally internalization of cholesterol from the blood, which the cholesterol which is coming from the portal vein into the liver by all these steps. But what you have to remember in one line, simple mechanism of action of Ezetimibe is that it inhibits this NPC1L1 mediated endocytosis or internalization of cholesterol into the liver cells, and so there will be decreased cholesterol in the liver, and this is what is the prime action of Ezetimibe. NPC1L1 mediated cholesterol internalization will be inhibited. Now these were the fifth type of drugs which were actually good for decreasing triglycerides, and these were fibrates. So you can see fenofibrate. These are some herbal products, as you can see, Hypolipidemic. Okay, it is written, yeah, it's a standardized botanical supplement. Oh my god, yo, good. We've come to the end of this video of hypolipidemic agents. So what I would like to say is that take care and eat good and study smart. So thanks a lot for watching, and please do like, subscribe, share and comment.